Hey everybody, welcome back to MedEd Insights, the channel dedicated to helping you get through medical school and residency by offering various insight and experiences of my own. This is something I wanted to start doing from when I first had this channel, is bring on other guests to talk about their specialties in medicine. And so we're really fortunate today, joined by a special guest, Dr. Matt Hardman, who is an anesthesia resident here at Mayo Clinic. So really excited, especially anybody who's interested in anesthesia out there, to have a little bit of a conversation with Matt, talk about kind of his background, talk a little bit more about anesthesia, and share some of those experiences with you guys today. All right, so Matt, thanks a lot for being here. Appreciate you joining me on a busy post-call day. I want to start off by just giving you a chance to introduce yourself to everybody out there, kind of talk about your background, where you went to medical school, and those sorts of things.
I'm Matt Hardman, originally from Utah. I went to medical school in Arizona at Midwestern University, Arizona College of Osteopathic Medicine. So I'm the token DO of my class. Came here for residency a year and a half ago. Did my intern year here as well, and now I'm a first-year anesthesia resident.
And I want to make sure I get it right. So anesthesia residency, you guys refer to yourselves as CA, correct?
Correct. Clinical anesthesia.
Okay, so technically you're a CA1?
Correct.
All right, but he's in his second year of residency. So, and Matt and I did our prelim years here at Mayo together, so that's kind of how we got to know each other. So next I want to ask you, a lot of people have really different stories and backgrounds in terms of what made them interested in becoming a doctor in the first place. So talk us through a little bit what got you interested in becoming, first of all, just a doctor.
So my dad is a teacher and my mom stayed at home. So I don't have any medical family members at all in my family or extended family.
Same here.
Yeah, I think I wanted to be a doctor really since I was probably in 5th grade.
Wow, so pretty early.
I don't know why. I just had that desire to be a doctor. And then as I went through high school and undergrad, I just always kept it on my radar. I entertained a few other things such as physical therapy or physician's assistant, or I thought about nursing school for a little bit, but ultimately just kept coming back to medical school.
So fast forward now to medical school, and you've at least decided you want to be a doctor. A lot of people out there go through a lot of different changes in terms of which specialty they want to go into. So tell us a little bit how you ended up becoming interested in anesthesia and choosing that as your specialty of choice.
I had an experience when I was 16 during my own surgery that first sparked my interest in anesthesia. I played basketball throughout my whole life and had torn my labrum as part of conditioning, so I had to undergo shoulder surgery, and for that surgery I got a shoulder block, what's known as an interscalene block. And I just thought it was amazing that the anesthesiologist could come in, and even though I was nervous, even though I was anticipating so much pain from this surgery, I didn't know what to expect. First of all, he had a wizard's hat on, which
like
made me laugh.
Like wizard's
hat.
Like
a wizard's hat with moons and stars on it. Made me laugh, and then not only that, but he was able to do this procedure that made it so that I didn't have any pain for the first 10 to 12 hours after surgery. Awesome. I just thought it'd be awesome to be that person who has the technical skills and hopefully the personality to help people relax before big operations. Going through medical school, I always thought I'd be interested in anesthesia. I tried to convince myself not to do anesthesia just so I didn't become pigeonholed.
Yeah, look for other things.
I entertained medicine and ICU quite a bit. I like critical care. I like taking care of really sick people. I entertained radiology a little bit. Interventional radiology I thought was kind of interesting. But ultimately I just came back to anesthesia again and again. And I'm maybe one of the rare circumstances, but I can pretty much say I knew I was going to do anesthesia when I started medical school, and now I'm doing anesthesia.
Well, that's rare. I know a lot of people jump around, they'll tell you like when you start medical school, whatever specialty you want to go into, you're probably going to change your mind 5 times, and I know that's the experience I had. So that's cool that from an early age, even in medical school, you're able to decide what you wanted to do and kind of start tailoring what you were learning and everything to what ultimately would be your career. So that's great. Now, I've heard a lot from people trying to decide between general surgery and anesthesia as one of the kind of common points of decision. So talk through a little bit about the differences in the two and sort of why one person might choose to do anesthesia over general surgery.
That's a really good question. So I loved my surgical rotations. I did. I like doing things with my hands. I like getting involved and doing procedures. I think the one thing I remember the day that I knew I was not going to be a surgeon, And it was during a 9-hour Whipple procedure where I was the medical student holding the retractor.
Yep.
And I needed to go to the bathroom and I needed to eat. And I just realized, you know, as much as I love doing these things with my hands, I didn't have the stamina or the mental, maybe fortitude to just stay focused for that long on one task. So I think that ultimately kind of steered me away from surgery. And part of the lifestyle as well. Family is very important to me. Having a life outside of medicine is very important to me. So anesthesia allows me to, at the end of the day, unless I'm on call, I really get to go home.
No, I think there's definitely becoming more and more emphasis on that quality of life in specialties. And I think it's helpful for students to hear that, you know, you can be a great doctor and you can still have a good quality of life and you can still have time for your family. So I think that's awesome that those were kind of focus points for you. Describe just briefly, a lot of people out there are medical students that know a little bit about anesthesia, but we also have some pre-meds that are watching. Just describe kind of quickly here what the role is of an anesthesiologist, both inside the operating room and then outside of the OR.
Anesthesia, you know, I kind of consider my job is to make the patient as comfortable as possible during the surgical procedure. That means I try to make them not remember the surgical procedure. That means I make them try to not feel the surgical procedure. And that means that I also try to create the best surgical conditions possible for the surgical team. My job is to basically first breathe for the patient if needed. So establish an airway. That's one of the big things of anesthesia. Take away their pain. Make it so they don't move or wiggle to the point that they're going to disrupt the surgical field. And also that they don't remember and can hopefully wake up smooth.
Now, what exactly is the training required to become an anesthesiologist in terms of, you know, number of years of residency, fellowship, things like that?
Anesthesia residency is 4 years. It's technically 3 years of CA or clinical anesthesia. So CA 3 is the max. But you have to do an intern year as well. And that can be in medicine, it can be in emergency medicine, it can be a transitional year. So I did my year here with you in internal medicine, and then now we'll have 3 years of clinical anesthesia. Fellowships are usually 1 year.
Okay.
There's not too many 2 or 3 year fellowships. They're usually 1 year. You can do cardiac anesthesia, OB anesthesia, peds anesthesia, critical care anesthesia. There's even fellowships on regional blocks.
Kind of like you had when you were a kid, yeah.
Yeah, to just get more experience with regional blocks. And I would say about half the people do fellowships at this point.
Do you have a particular fellowship you're interested in, or what are you planning?
If I were to do a fellowship, it would be critical care.
Okay.
I really do like taking care of sick people. Critical care can be tough and challenging, and you can have weeks where you're working 100 hours a week. Wow. And so I don't know fully. Again, I mentioned the outside of medicine life's important to me. So I'll get some experience in critical care in the next year or so and kind of make that decision.
We're going to change it up a little bit. I'm going to hit you with some random questions here. I didn't tell Matt what these questions were going to be, so these are going to be totally random. Get to know him a little bit better. First thing that comes into your head. Last thing you watched on Netflix.
My wife and I are watching Dexter.
Okay.
Right now.
I haven't seen that
which is I think we're late on the boat.
Yeah, that's
because people are usually a little bit farther ahead than us, but we're a little bit behind the times.
Scrub hats or old lady cafeteria hairnets?
Yeah, so Mayo's interesting. Brian knows this, but Mayo has a lot of these unwritten traditions of the Mayo Clinic. Everyone wears surgeon hats.
Okay.
Yeah.
Okay.
So
when I was a student, I preferred the old lady hairnet in the cafeteria, but
yeah. Sometimes we'll have like bouffant Fridays or bouffant Mondays, but most of the time it's the surgical hat.
Waking up in the morning, coffee, tea, or nothing?
Yeah, so nothing for me. If I do get something, I kind of reach for the Mountain Dew.
Okay, so you're a pop kind of guy. Is it pop or soda?
I call it soda, but
that's what I
think. In Minnesota, it's pop.
It's
right?
pop, yeah, it's pop up here. So you're post-call in the hospital. You've got to get some food. What's your go-to hospital meal that you're going to be eating?
My favorite meal in the hospital is available between, I think, 3 and 5 in the morning. Or 2 and 4.
Yeah,
I don't
yeah,
remember
2
the
and 4.
Cafeteria hours, 2 and 4.
Yeah, yeah.
They have really amazing biscuits and gravy.
They do.
Down at St. Mary's
can testify
Hospital
to that.
cafeteria.
Yep.
So
Excellent.
I think that's, if I'm ever in the hospital between 2 and 4, I try to make it
Going
over
for
there.
the biscuits and gravy.
Yeah.
What Malin potty score would you give Jabba the Hutt?
He's probably a 5.
It's
Even
like
though
off
it
the scale,
only
right?
goes to 4. Yeah, I'll probably call him a 5. Yeah.
Okay. What type of person do you think is a good fit to become an anesthesiologist, and what are some personality characteristics that you think are really important for people choosing to go into that field?
So anesthesia kind of requires, I think, an interesting personality. You have to be able to be assertive and dynamic and think quick on your feet, because there's times in anesthesia where you go from everything is going well to everything is not going well quick. And you have to be able to, in those moments, think on your feet and come up with what you're going to do. You don't have time, like sometimes we did on internal medicine, to talk about it for half an hour,
Sure.
what our differential is, et cetera, et cetera. You just have to be able to go. Also in the surgical suite or in the OR, it's kind of a dynamic field. The conversations between the surgical team and anesthesia are not always, excuse me, sir, can you not do this? And then the surgeon saying, actually, yes, I see your point. It's very, I need this now.
Yeah.
Yes, sir. I need this now.
He's moving. And
Yes, yeah, it's a pretty dynamic field. And so you kind of have to be a little bit tough-skinned sometimes with surgical teams, be able to be assertive and stand up for your patient when needed.
Walk us through your typical day as an anesthesia resident.
We start really early. That is one thing about anesthesia. If the OR is scheduled to start at 7, or if the surgery is scheduled to start at 7, that means we have to be there well in advance to set up the operating room. So we turn the lights on to the operating room basically about 5:30 in the morning. I have to set up all the equipment, all the anesthesia equipment, drop all the drugs, get all of my lines available that I need. I see the patient in the morning at some point, go over their, before I see the patient, review their chart, then see them, go over their history with them. We always start the first IV of the day as an anesthesia resident. Start the first case usually between 7 and 8. Depends on your day. There's sometimes where it takes an hour to set it up because you're doing all sorts of lines. You're doing a spinal block, you're doing an epidural, etc. There's other times where we just say, probe sucks tube. It's a pretty standard case where we just do the induction meds, get an airway, and we're off to the races. It only takes 15 minutes or so to get going. And sometimes that one case will go the whole day. I've been involved in 14 plus hour surgeries. Wow. Sometimes that case will go 30 minutes. So that's one thing about anesthesia, is every day is different. I feel like here at Mayo is actually pretty good because they're pretty good at trying to get us out between 3 and 5 so that we have time to study, read about tomorrow's cases, do research, etc.
What are some of the common misconceptions or stereotypes about the anesthesia field? Some that are both actually true and some that you hear other providers talking about that are completely false.
Not everybody understands everything about what goes on to do an anesthetic. When you deliver a good anesthetic, it seems like it's just you go anesthesia on, anesthesia off.
That's the impression I get. Yeah.
It's definitely not that way. There's a lot of things that go on. There's a lot of patient variability. Patients can be fully paralyzed according to the monitoring that we have and still move. If I know that sometimes the surgical team expects them to be completely still no matter what, and we do try to do that, but if you take your surgical device and stimulate a nerve directly, the patient's going to move. There's a lot more intricacies that are involved in anesthesia that people don't quite understand at times. I think of my dad who tells me, so for anesthesia, you just turn on some sort of gas and then that's it, right? Then you can look up your stock prices or whatever. Yeah. No, there's a lot more involved. If someone's looking up their stock prices during the surgery, it's because they're really good anesthesiologists and they've been able to get the patient into a good, stable level. Yeah. For me as a CA1, sometimes it takes me a few extra minutes to find that stable plateau or that range where I can relax a little bit more. Sometimes I end up chasing my tail for a few more minutes than the veterans.
I've heard it's a lot sometimes like flying a plane. If you think about flying a plane, the hardest parts or the most dangerous parts are when you're taking off and then when you're landing. And I've kind of heard that analogy used about anesthesia, that it's challenging in the beginning of the case, and then in the middle it can be a little bit quieter, and then when someone's coming out, it's also a little bit more risky.
Absolutely.
So there's a lot of great things, but what would you say is your least favorite part about being in anesthesia?
In anesthesia, we never quite know when we're done. You might be scheduled for 2 to 3 surgical cases, but those surgical cases, they're scheduled for 3 hours each, but that's such a guess. Every surgery is so different. You never know what you're going to actually find once you're in the surgical field. So I think that, I'm done as early as 1 and as late as, 8. So when my wife says, hey, are you going to be home for X, Y, or Z at 6? I say, I don't know. And that can be a challenge at times. I think another thing of anesthesia that I've already kind of hinted on, but there's a lot of strong personalities in the operating room. And sometimes you have to be able to navigate that and realize that you're all working for the betterment of the patient.
Yeah. And
anesthesia is it's almost like a service type job. These are not primarily my patients. They're the surgeon saw them in clinic. It's the surgery that they came in for, and it's the surgeon who will take care of them after. My job is to help them get through their surgery.
Interesting.
And so if you try to be a team player, I feel like those dynamics are a lot easier to navigate, as opposed to sometimes the yin and yang that can happen between surgery and anesthesia.
So we have a lot of pre-meds, medical students, residents that watch videos on this channel. Any general advice that you would give them, whether it's a student who's a pre-med, getting ready to start medical school here in a week or so, just general tips that you've picked up on based on your own experience in medical school and now that you're in your second year of residency?
I think the question for those young people in their medical career path are really make sure this is what you want to do. It's a challenge. Medical school is tough. Residency is tough. And if you don't really want to do this, there's a lot of other jobs out there that are equally fun and that you might enjoy. I feel like the people who got into medicine because their mom wanted them to, or because it was expected of them, they're kind of miserable. You really have to enjoy what you're doing. In terms of how to, succeed and how to, any advice, it would just be, it's a marathon. And you have to be able to run that marathon and work hard and stay motivated. You have to be able to take care of yourself. If you try to sprint for every one board exam, there's going to be another board exam. And there's going to be another board exam. And there's going to be another one. I feel like you have to be able to maintain that good work-life balance because there's times where you need to take a break in order to keep going on the long career path.
And before we finish, I want to talk to briefly, I know Matt is a blogger and started up a blog here recently. And so tell us a little bit here about what your blog is about, kind of why you started it, and what your goal is and what you're hoping to accomplish with your writing.
As I mentioned, outside of work is important to me. That involves my family, that involves my church as well. And so member of the Church of Jesus Christ of Latter-day Saints, also known as Mormon kind of commonly. And I just wanted to start a blog about what it's like to be someone who's involved in a religion or a church during residency.
Definitely.
Talk about the perspectives that it gives me, talk about the balance that I feel like it helps me. And this could be for any religion, whether, just if you're involved in a religion, just talk about if that's something that you can maintain during residency. I do talk about in my blog about just aspects of the church, that the belief system that I have and how it helps me and how I use it on a day-to-day basis. And it's been fun. It's kind of an outlet for me. It's fun to see some people reading it. I've been kind of surprised. I didn't expect only a couple people to read it, but it's rochestermormon.blogspot.com. It's basically a way for me to express my beliefs, but also tied into how being involved in my church while being a resident and how to navigate that dynamic.
Yeah, I think it's great. I've checked it out a couple of times, and I don't personally share the same religion, but I am religious, and so it's been great to see that ability for someone to, not lose those beliefs and be able to comfortably express them and figure out how to kind of navigate them, because there's lots of emotional challenges. I'm sure you've had patients pass away this year, last year in residency, and so I think it really helps to have that strong faith foundation. So I think that's great that you're, talking about that, sharing that, and helping other people in medicine realize that it's okay to still have that identity and not think that you have to totally, back away from those things when you take care of your patients. So
Absolutely.
excellent. Yeah. Well, thanks a lot. I appreciate Dr. Hardman here from coming and joining me today. I know he's post-call, so very tired, but I really appreciate him taking some time this morning to come along and do this. I hope it was helpful for anybody out there watching. Stay tuned. We've got some more of these planned. I hope this went well for the first time. We've got some other great residents that I work with that are going to be coming on to share their similar experiences. So thanks again, Matt. Really appreciate you doing this, and we'll talk to you guys next time. Bye.